So, good evening, everybody, and welcome to our EVO Fusion webinar. Thank you for your interest in our newest denture solution, our digital denture EVO Fusion. My name is Roland de Pape, and I am the head of the product management here at Modern Dental Europe. Modern Dental Europe actually is part of the Modern Dental Group, a global network of labs belonging to the Modern Dental Group. And in Europe, we are active in 11 different countries. Most of them are active under the Elysée Dental brand. That's for the Netherlands, Belgium, Denmark, Spain, Finland, and Norway. But we are also active in Germany as Permadental, in France as a Labocast, and in the UK and Ireland under the Southern Cross flag. So we belong to the global Modern Dental Group. We also have branches in the USA and in Australia. And let's say we share our vision. We share the launch of new, exciting, future-oriented solutions. And one of those solutions is our digital denture, EVO Fusion, which we will discuss in this webinar. So thank you all for your interest and for participating. Over 50 million dentures are made globally each year, and more today are done digitally. But if you ask a lot of dentists today, did you make already a digital or a digitally produced denture? Most of them will say, no, the technology is not there yet, or I'm not quite sure how to handle it, how to start the workflow for a digital denture. So in this webinar, you will see, and we can tell you that actually the technology is there. It's no longer the future. We produce these digital dentures every day, and we made already more than 1,000 digital dentures. So we have the largest milling center for digital dentures in Europe, in our production facility in Germany, in Emmerich. So it's no longer the future, it's here today. And the reason why we should start using digital dentures instead of conventional dentures is mainly about the main benefits are that we have a better fit overall. So we have much less pressure spots. We don't have polymerization shrinkage anymore, like for conventional dentures. So that's important. There's no powder liquid mixture anymore. So we completely avoid that because we mill our dentures from pre-polymerized discs. So we have predictable results in the end. And what's also interesting and new in this workflow is the functional try-in. We don't work with a conventional wax and denture teeth try-in, but the printed functional try-in. I will explain all about this in this webinar. Overall, the end product is has a better fit. It's stronger. It's monoblock produced, so that means it's much stronger. And of course, it's a digital product like any digital product. It's also easy to reproduce. So those are the main benefits. And then a question we get a lot is from our clients is, do I need to change anything to my existing workflow? So basically, there is no need to change, but it's possible to change. There are different ways to start front end the workflow, and we will take it step by step in this webinar to show you the different possibilities. Basically, you can start from a conventional impression, and you can either scan. If you have an intraoral scanner, you can scan this impression yourself, or you can send the conventional impression to the lab. And then we start in the lab the digital workflow. Or there is a third option, you can also do the whole procedure 100% digital. That means if you have an intraoral scanner today, there are ways to scan also an edentulous arch perfectly, and I will show you how to do this and which tools should be used for this workflow. So basically, we have in the portfolio, we have 5 different solutions under the EVO Fusion umbrella. The first one is the normal EVO Fusion denture. That means this is a new denture when the patient has his first denture made, so no existing old denture is available. So this starts from A to Z. Then we have the second option is the EVO Fusion Twin. So this is where the patient already has an existing denture, and this can be used, of course, to take an individual impression again in this old denture. This is called our twin, Fusion Twin denture. The third one is the EVO Fusion Immediate. So that's an immediate digital denture where we don't have a try-in phase. So this is from the impression straight or the scan straight to the final denture. And then today it's also possible, the fourth option, to make a digital or a partial denture the digital way. So that's our EVO Fusion Partial. And the fifth option under the EVO Fusion portfolio is the overdenture or the cover denture, and there we can offer this solution, digital denture, on a CAD/CAM milled bar, or also, of course, on locators or ball attachments. So all these indications or all these possibilities will be explained in this webinar. So basically what we did is we prioritized the needs from the dentist and the patient, of course, and the result is actually today our EVO Fusion denture. It's an efficient or an end-to-end process where basically as a practitioner you can choose if you want to change something to your existing protocol or if you want to stay with your existing protocols. So here you see on this slide the different steps we normally take in the workflow, going from the conventional impression over the bite plate with wax rim, and then in the lab we digitize the setup. That means we will print the try-in, and so this can be tried, and then after the modifications, if needed on the try-in, we will finish the denture by milling it. Today we mill all our digital dentures from discs. That means we mill both the tooth arch and also the pink part from pre-polymerized PMMA, high-end PMMA discs. This is a special technique we use to mill those. I will show you later on the slides how this works. Basically, we embraced both technologies, printing and milling, and in the end we did our own R&D, and we chose milling over printing because the fit is overall better, and also the product is much stronger if we mill it, if you compare it to printing. So today all the EVO Fusion dentures are milled. So looking at those clinical treatment steps, normally you take an impression. The second one is then the individual impression and the bite registration. And then with the bite plate and the wax rim, you can either scan also those or send them to the lab to be scanned with a tabletop scanner. If you want to go 100% digital, this is the third option. You can do this today. There is no physical impression needed anymore, and we work 100% model-free for this option. If you have an intraoral scanner, you can offer this high comfortable workflow to your patients, which means less time, less appointments, and a higher standardization of the whole process. So the main issues when we want to scan a dentulous jaws is the fact that people think we are missing geometric features. If you are scanning a tooth arch, this is quite easy for an intraoral scanner. But if we have an edentulous arch, people think I don't have teeth, so I'm missing those features. Well, actually, also on an edentulous jaw, we have curves, we have concavities, we have convexities, retention zones. So this means we have all those geometric features available to scan. So the whole issue is that, of course, they are not stable. So are we complicating things? If you look at this video, you clearly see that the tissues are, of course, moving. If we move the cheeks, if we want to use an intraoral scanner here, we will move the cheeks, and of course the tissues become move and are unstable. So we need a tool to stabilize the whole situation. And actually, residual ridge is accessible. That's no problem if we would use a retractor. But of course, another issue is when we use an intraoral scanner is the fact that with the camera, the hardware, we are capturing different images. You can compare this with taking a panoramic picture. All those different pictures are then stitched together in a perfect image by the software. And there, of course, if the tissues are moving, we have a problem. So we need a tool to provide us access to the ridge for the scanner tip, and we need also that this tool stabilizes the tissues, extends the work field we want to scan, and keep the tongue and the cheek away. So that means as an operator, we need to follow a certain strategy to scan these edentulous arches. We need the perfect tools to do this. And then, of course, we know that we can scan perfectly because we have those geometric features also on edentulous jaws. If you compare it with a car driving over a slippery road, of course this can be dangerous. We can go left and right, everything is moving. So what we are using there are winter tires or chains to keep control. And exactly the same we can do if we use this kind of retractors. These retractors are called the Lorusso retractors. And actually more and more dentists today, they discover the benefits of these retractors and using them for digital dentures. There is a specific scanning strategy we are following, and this is really a true revolution because now we can say that for our EVO Fusion denture, it's a digital denture, not only on the lab side, we not only are producing these dentures or fabricating them digitally, we are also scanning and using this scan. So it's a 100% digital process. In the lab, of course, the entire production process has already been digitized. So this leads, and we have seen this, to stronger and to better fitting dentures already. But until now, before using these Lorusso retractors, it was not really possible to do it on the dentist side, front end, digitally. So the conventional steps of impression taking were still performed chair side because of this moving mucosa. So thanks to these Lorusso retractors, an edentulous jaw can now be scanned in a passive state. And this means individual trays and impressions have become things of the past. If you have an intraoral scanner, if you have these Lorusso retractors, you can really scan your edentulous jaws in a perfect passive state and order a digital denture. So the retractors are available, are a patented medical device. First of all, they were developed by Professor Lucio Lorusso from Italy. They support the intraoral scanning of dentulous arches, and they spread and stabilize basically the tissues, the lips, the tongue, the cheeks, and they facilitate like this the movement also of the scanner tip. It works like a track for the scanner tip, which can be followed, and this means you actually maintain an adequate distance from the arch or from the ridge at all times. So here you see the left and the right Lorusso retractor for the lower jaw, and then we have and we use it like this, so not perpendicular on the sagittal plane, but we have to shift it a little bit to scan one side, keep the handle on 7:30, and we scan the anterior zone and the left side, and then we use the other retractor for the right side. And you see that the anterior zone is double scanned to merge the scans together. So we simply stop after scanning one side, switch to the other retractor and scan the other side. So today it's no longer a problem if you stop scanning. This is really a thing from the past. Today the software, it's much more developed, and there is absolutely no problem to stop once or twice while you scan. Also a tooth arch. Basically, if you scan a tooth arch also from a lower jaw, you would start on the occlusal phase, and you can just stop after this part, then turn the scanner, scan the lingual side, stop again, and then scan the buccal side. The software is perfectly capable to merge those different steps together in one perfect scan. For the upper jaw, there is only one Lorusso retractor, obviously like this. So we scan the upper jaw like this. So it's an easy, it's an accurate and very predictable, but also a faster workflow than taking impressions and scanning those. And thanks to the let's say the specific geometric features of these Lorusso retractors, using this new and understanding this new concept, it makes life much more easy, also for the patient, of course, much more comfortable. So it's also, of course, important to understand the whole principle and the whole concept from these Lorusso retractors. Basically, there are different tools available to learn how to use them, and here you see a QR code. I will repeat it at the end of this presentation. If you scan this, you can subscribe to Professor Lorusso's webinar, where he explains the whole concept perfectly. So you need to understand this concept, because if we use let's say a conventional impression, we use impression material, we build up pressure on the soft tissue, and using this impression material, we push away a little bit the soft tissue. So this is a compressive impression. So the denture retention is then a result of a perfectly closed peripheral border which creates a vacuum. But of course, if we scan now with these Lorusso retractors, there is no pressure. We don't use impression material, so we don't build up pressure. This means this is a completely different impression. It's a mucostatic impression. And this denture retention is also different, right? It's no longer a closed peripheral border. If we scan, we have a mucostatic impression. This means we have retention due to a perfect intimate contact and also surface tension. This is tested, and already there are a lot of papers. Actually, Professor Lorusso already published 17 papers on this and made hundreds of dentures. And of course, we are also doing this now, so we can support this workflow, and we know that this surface tension retention really works. Of course, you need to know, you need to follow the scan strategy, and you need to have, of course, the instruments, the Lorusso retractors, because these will stabilize and retract the tissues. So if you are interested to do everything 100% digital, I suggest to scan the QR code and to follow the full webinar from Professor Lorusso. Okay, so either way, if you have an intraoral scanner, and if you still like to take an impression and scan the impression, or if you send us the conventional impression, or if you use the Lorusso retractors, either way, we receive an impression, and in the lab, everything goes digital. This means we make a digital setup, first of all, which you can see in this video. So after receiving the scans, we import the scans in the design software, and this is really a very intuitive design process. The digital dentures are actually individually designed and also customized. So we start by creating the models, the digital models. We remove all the artifacts first, and then we survey the borders, and then the system features extensive tooth libraries, and also in addition sample tooth setups which we can use, so the designers choose those and really see where they position the teeth on the arch. And this is important. This is much more difficult if we in the lab the technician makes a conventional denture in the conventional method. We don't see where the arch is because there's always wax in between the denture teeth and the arch. So here in the digital process we have complete control, and we can actually set up the teeth through the digital wax rim. We can adjust everything we want. We can adjust the shape of the individual teeth. We can morph them. We can make them longer, wider. Various tools are available in the software. And of course, we can also change after the setup and the individualization of the setup. We can also choose for the pink part, the gingival design, have more or less root structure in the pink. So everything is possible in this design software today. If the whole setup, digital setup is done, then we check everything in a digital articulator. So we check the lateral movements, the protrusion, everything is checked. And that's a big advantage because all those individual setups and patient data are stored then and can easily be changed or adjusted afterwards after the trying phase if needed. So that's the first step. If the design is done, we need a try-in step, physical try-in. So we will print a try-in, and this try-in is completely entirely made of a tooth-colored resin material, similar to A2. There's no pink on this try-in. Only if you want, we use a pink opaque on the anterior zone to make it a little bit more aesthetic. But normally we just print it in an A2 resin, because of course the try-in is only used for a functional fitting phase. We try everything with the try-in. So here you see a video on how this is produced, just from an A2-like resin. The digital design is printed, and then this is light cured and ready to test. Functional try-in. What does it mean? A functional try-in means that it is stable and it's relevant. So it has basically the same fit and stability as the final denture, because it's printed from the same design already. But the patient can really, this means the patient can really try it out. The patient can speak with the try-in, can eat with the try-in if needed, and you can really check the lateral movements. The teeth will not be loose like in often happens in wax. So you can really test this. If you need to change something, it's possible to grind it, of course. It's just resin. You can adapt, you can grind, you can add some resin or composite material if you want. And then of course, if you adapt it, you rescan it and you send us the rescan, because of course we need these modifications for the to adapt the design towards the final denture. Another option, instead of grinding or changing it physically, is to communicate through a V diagram. We have this V diagram available on our order forms. And here, this is basically for the anterior zone. If you want to communicate on the position of the anterior teeth, you can mark here the desired modifications in terms of length or height, both in vertical position or in horizontal position. You just mark the lines, and this is also available as a digital tool, so you can click on the lines and then send this along with back with the try-in, so we know everybody understands exactly what needs to be done. Okay, so that's for the try-in. If we look at the second option under the portfolio, which is the EVO Fusion Twin, this is the option when the patient already has an existing denture. So then we use this twin protocol. So here we take an individual impression in the existing denture. So the existing old denture is used as a reference denture. And if needed, of course, we can also take a new bite registration with bite registration material on the teeth, because often, of course, the teeth are worn down. So we need, of course, a new vertical dimension of occlusion. So there you can use a bite registration material. You can increase then the vertical dimension of occlusion by 1 millimeter, for instance, using the leaf gauge technique. I will show you how this works in the video later on. Of course, here you can also use the V diagram for changes if needed. And normally you can order also a try-in. This is not always needed, but of course it's available if you want a try-in. And here you see again the advantage of the digital design, because we do the actual setup for this twin denture through the digital existing setup of the old denture. So this is visible in the scans, and we can and the designers can easily set up the new teeth and improve those. So here is a video I will show you on the whole procedure. So basically this is an old existing denture. We use some adhesive first, and then heavy body impression material for the first impression, mucodynamic impression. That's the first step. And then after setting, we can remove with a scalpel the overflow, and then we use a light body impression material for the second step of the impression. So again, a mucodynamic impression, and you see that the old existing denture is used here as a kind of individual tray for the first step of impression taking for our EVO Fusion twin denture. So in this case, we also want a new vertical dimension of occlusion. So we will remove again after the second impression all the overflow before we can scan. And of course, we need also a scan from the antagonist jaw, the lower jaw in this case, and then scanning the maxilla impression. So we need to capture all the anatomical features. That's important. So you need to follow a step-by-step scan protocol to achieve an accurate scan result. So you hold a scanner above the tuberosity area, and you just start scanning along the center of the residual ridge towards the opposite side while moving. Rotate the scanner in a 45-degree angle, and then you scan the internal, the buccal portion of the ridge and over the peripheral border. So make sure to always capture the entire border, and then you bring back the scanner to the papilla incisiva, and we swipe over the palatal area. So make sure all the images are always accurately stitched, and then you continue scanning the teeth, the buccal, the facial, and the occlusal surfaces of the denture for the bite alignment. Of course, always try to overlap while scanning the previous scanned border. So you see, when this is done, we also take, with the leaf gauge technique, a new vertical dimension of occlusion. Then the design is done by the designers, and then the try-in is printed. We check the try-in, and on the try-in, we have to check, of course, first of all, the fit, which is excellent in this case. Also the bite, the movements, the horizontal plane, everything is checked. And if you want, if needed, you can always adapt and grind. If not, you can improve the try-in, and then we can proceed with the final production of the final denture. So a happy patient. This is a straightforward protocol for our twin denture. And what is interesting
today for Kevin
is the fit, the excellent fit of our digitally produced denture.
See the fit is very good with the denture, good extension. Retention on this is again very good.
It's even funny in this video
easily
that the dentist really has trouble to get the denture out because it's fitting so well.
There's the problem with Kevin's old denture. It's just open again for Kevin, and you can see that that denture won't remove easily. Fit again is very good, very stable, but I'm not able to remove that denture easily at all. In fact, if I try to get the denture out, I'm trying to get.
So you see how well the denture fits.
Pressure there.
With pressure just like that, it's impossible to remove it.
We're way up into the tuberosity area.
So in the tuberosity area, you can unlock the vacuum and then remove the denture. But overall, you see how these digital dentures fit if you compare it to some conventional techniques. Okay, so for the third option under the EVO Fusion umbrella, we have the immediate denture, of course. So for patients with terminal dentition, so here EVO Fusion Immediate allows you to order a digital denture directly from the impression or from the scan data, using also this V diagram as a tool. So on this picture, you see the teeth before extraction and how the V diagram, the red lines on the V diagram indicate on how the anterior teeth should be positioned for the digital setup. So here we have a patient case to show you step by step. So this patient had terminal rest dentition. She needed an immediate upper and lower denture. The changes were indicated on the V diagram, and later she will get implant work. So this is the first step, taking the scan of the upper and the lower jaw, and of course also don't forget correct bite scan. If we receive this in the lab, we do a digital setup, a design, and this is the final design of the denture. We modified the teeth, the front teeth, a little bit in accordance to her old natural dentition. So this means a little bit abrasion on the incisal edges, just like her natural teeth showed before. And if you compare then the digital setup of the immediate dentures, you can see that this is a good match. Also in the face on a picture, you can see that we can really design this face driven. So this is all possible in the digital era today. Then we mill the dentures, and you see that we have also some glass beads there, because these will be used for radiographic images later on for the implant placement. So here then the clinical steps before extraction on the left side, after extraction on the right side, and same day the immediate dentures are placed, and the patient is very happy to be able to go home with this nice new smile already at this stage. Then 10 days later she comes back, and the denture or immediate dentures are rebased with soft material, and she's now in the healing phase. So that's that was the third option, the immediate. And then for the fourth option, as I told you, we have also the option to make partial dentures today in this digital protocol. So exactly the same steps are followed. After the impression or the scans, we do the digital design of the trine, and you can trine or try the trine at share site at the patient, and then you can, if needed, communicate again on modifications if needed on the trine. And here exactly the same benefits, of course, a better fit, a better stability, less pressure zones also, because it's the same digital production steps. So we don't have powder liquid anymore. We mill everything from discs, which means good comfort, less pressure spots, and if needed, of course, with one push on the button, we can reproduce because it's all digital. After the partial option, we also have, of course, a cover denture or an over denture possibility under the EVO Fusion umbrella. So for this option, actually, most of these overdentures are made on a bar. So these are produced 100% in a digital process. The bar and the denture are then delivered together, resulting in a perfect fit of this CAD/CAM manufactured titanium bar, first of all, this bar construction, and then we have the covered denture with the matrices polymerized to click on the bar. Another option is a covered denture on locators or on ball attachments. That's also possible. So the same, we also follow here the same steps. We also print first a trine. You see it here, the design of the trine, and then also the intaglio of the printed trine, where you see there is digitally a placeholder for the bar and for the matrix. So this can be checked in the mouth, and after approval, we continue reducing the bar and the overdenture. Okay, so a little bit more on the materials we use and how we produce these digital dentures today. First of all, at the beginning, I told you that we use discs to mill both the tooth arch and also the pink base. So these are both highly quality materials which are high impact resins, PMMAs. The tooth arch is basically milled in one piece from this cross-linked PMMA disc. So this is a so-called monoblock design. You don't see that it's one piece, but this monoblock, of course, results in a stronger end product compared to conventional dentures where you have single teeth. So this is a multi-layered material, which means we have different layers, cervical, middle zones, and more translucent incisal zones. Of course, to copy the natural effect of the natural tooth structure. So actually the discs we use today have 5 different layers to copy the natural tooth structure. So this really results in the most aesthetic teeth for milling. We milled them on those PM7 machines, and we have about 10 of these machines now running 24 hours a day, producing a lot of these digital dentures in the biggest milling center in Europe, actually, in Emmerich in Germany. We use an oversized milling strategy. So this means this is a seamless and a very fast digital manufacturing process, and we fabricate like this very high quality removable dentures. We only have a few steps in the manufacturing process. So this means we have a pink disc and a white disc to start from in this oversized milling strategy. First, they are milled a little bit bigger, both the pink and the tooth arch, and in this phase they are bonded together with a special bonding agent. After the bonding, they go in the pressure pen to polymerize, and then the discs or the disc goes back into the milling machine for a second milling step, and then we do a fine milling strategy, which results in an almost finished denture, where actually we only need to manually only need to basically polish after this fine milling step. So very few manual working steps. There is hardly any disruption in this digital work process. We don't need any plaster models anymore. The whole setup is placed in a digital articulator, as you have seen. We use extensive tooth libraries during the design. We use this premium PMMA materials, and in this flawless digital process, only a polishing step, 10-minute polishing step, is really done manually today. For the ping base, we also use a very strong high impact denture material, and by default normally we use the most popular color, which is the pink V. V stands for veined, unless you indicate on the order form or on our digital order form iris that another different color is required. Then we also have darker pink shades available, which match, for instance, darker skin tones. So these are all available and can just be ordered on the order form. Good to know. Repairs or rebasings, if we need those, this can also be performed without any issues using conventional repair resins on this materials. So it's basically just cross-linked high impact PMMA material, which is already pre-cured under pressure during the manufacturing process, avoiding of course a lot of problems in terms of shrinkage, but of course we can repair them using normal resin. So here you see the order form, and on this order form you can choose from the different indications, indicate if you use a scan or an impression, and of course for the over or cover denture, you can also indicate which type of implants, if you want the retention on locators or on a bar. You can choose the color also for the pink part, etc. And you see that also we have the V diagram on the order form, so this can be used to communicate on modifications after the trying phase. Good to know that of course the production of the EVO Fusion is done in Emmerich, in Germany, as I told you before. So for our European group, we have very lean turnaround times for individual tray, step, or bite plate, wax rim, and trying. We need 4 days, and then for the final denture production, 6 days door to door. For the cover denture, this includes, of course, the production of the precise CAD/CAM milled titanium bar. We need 9 days. For prices, I suggest you contact your local office, because we have a lot of participants here in this webinar from different countries. So please contact your local Élysée office or Permadental Labocast office, Southern Cross office, and they will be happy to send you the price list in your local currency. If you just send a mail or call your local Modern Dental branch. All the information which is shown in this presentation is also available or can be reviewed in a very nice catalog. So this can also be ordered from our local branches, and there you find everything that I've been telling you so far on the different indications and material options, etc. Nice catalog. So to finish altogether, I think we can say now we are really on top of this game of producing dentures digitally in the lab. As I told you, this is a 100% digital process. Front end from the dentist side, you still have the option, if you don't want to change and stick with your conventional protocol, taking a conventional impression, you can do this, no problem. You can then scan it with your intraoral scanner or send it for us to scan. If you want to try the 100% digital workflow, please contact us to order these Lorusso retractors. So these can also be ordered from your local modern dental office. We are reseller for these retractors, so please ask information from your local office. In the end, you get a denture EVO Fusion, which offers your patient an optimal fit, good retention. We don't have polymerization shrinkage problems anymore because everything is milled. Predictable results. Please do try this functional try-in and also see and try the benefits of really using a functional step for the try-in. So this means taking advantage of the same retention and stability as the final denture. Let your patient try it, eat, speak with this try-in before you approve it. So basically, we need less appointments, or this is possible if we do everything digital. So that's clear. Then we don't need an alginate and then an individual impression anymore. You just scan and we start designing. So less appointments are possible. And overall, monoblock, as I explained, so we have a stronger base and arch. Digital, so reproducible. And just to finish this webinar, I want to show you also what we find today in literature. You see that in these white papers and studies, conclusions are always that CAD/CAM fabrication processes are the most accurate if you compare them to conventional techniques where from packing or pressing or pouring dentures. This is basically this will be of course something from the past. If you look at the very nice results we get from these digital workflows today. And also the second study, same conclusion. Comparing also CAD/CAM and conventional dentures, it can be concluded that the main advantages, as I already told you, reduced clinical share time. We digitize, so we archive all those data. It can be interesting if we have to reproduce it later on. Significantly higher retention, as we have seen also during the presentation and in the videos. So more favorable clinical and also patient-centered outcomes. So also the mechanical and physical properties are superior to all those mechanical or physical properties we know from conventional dentures. So overall, a better product, an easy workflow, and I suggest to try it, to test it, and to see for yourself how you can take a step in this next step in this digital era. I promised you that I would show again this link to the webinar, a very interesting webinar from Professor Lorusso himself. So if you scan this QR code, you get you get a subscription page, and you can see or you can watch the webinar, and Professor Russo will explain for you the whole concept and protocol of this Lorusso retractors. So that's it for the webinar for my part. I hope you enjoyed it and that you learned something from our new product and the protocols we are using here. And now is the time, if you would have any questions, to ask them. You can use on the right side the question box, and let me check if we have already a question there. I don't see any questions now. So good to know. If you would have any questions later on, then of course you can just mail your local office. And if we have questions coming in, what we usually do is we answer those and we send the questions and answers to all the attendees from the webinar so that everybody has the same information, and we share all those informations with all the participants. So for now, I still don't see a question. No. Okay. So then I think we can end the webinar here. I hope you enjoyed it, and I hope you will try out the EVO Fusion denture, and maybe also, if you have an intraoral scanner, please try the Lorusso retractors, which are really a game changer, not only for digital dentures or to scan edentulous jaws, but also for implant work. We will launch also a new protocol to scan, a new strategy to scan for full arch implants using those same Lorusso retractors soon. So I suggest, if you are interested in that, stay tuned because we will come back soon in new webinars talking about this new scan strategy for full arch implants. See you all maybe later in another webinar. Thank you for today, and enjoy the rest of your evening. Bye.